Hi everyone. So today in this video we are going to discuss about application of knowledge of occlusion. So how can you apply the knowledge of occlusion in different clinical scenarios? So number one, you can apply during the treatment planning. There are different ways to use your knowledge of occlusion during treatment planning. You will be able to understand various failures of the teeth happening because of the occlusal issues. If you do not understand the occlusion, then you will be missing one of the key reasons why teeth fracture and break. Although there are other reasons as well, you need to be able to eliminate any occlusal issues if there are any. You will be able to assess mounted models, and this is something very important. So even if you're not being able to mount models, you should be able to assess mounted models if you're asking technician to mount the models. And I've seen many times where colleagues ask for wax up of the case and they receive two models, mounted models with the waxed up but no articulator. Now without articulator you cannot assess mounted models, and unfortunately most of the articulator are not calibrated. So even if you have articulator and the technician has sent you models, doesn't mean that your articulator, even if it's the same brand, you will be able to put the models in your articulator and assess it properly. So you need really the articulator the models were mounted on in order to assess the guidance, assess the occlusion, to make sure that the technician has implemented the occlusal schemes the way you want it. Assessing first point of contact is very important, as we discussed in previous video, that you need to make sure that you assess first point of contact to avoid disappointment when you are preparing posterior teeth in order to reduce their vertical dimension. You will be able to identify different occlusal issues if you have the occlusal knowledge, and make sure you will be able to diagnose this before you do any treatment planning or before you do any treatment. Because if you, let's say, restoring a tooth and that tooth has non-working side contact, you don't want that non-working side contact on your restoration. In my opinion, it is perfectly okay to have non-working side contact if patient has that in their natural dentition. It's not a disease, but I would not implement, or I would not incorporate that non-working side contact into my restoration. It helps you planning for long-term stability by understanding occlusion, by treatment planning occlusion into your bigger cases. It will give long-term stability to your restoration, and also it will help you for planning for failure. So if you are providing patient with canine guidance, and if you think that the canine is not in a good condition and patient may lose that canine, then you may want to include progressive guidance, where if the canine guidance is lost, then patient guidance will go on to premolars in order to achieve group function. While you're doing conformative treatment, it will help you in making your restoration more predictable, reduce appointment time so the patient don't have to keep coming back and forth because the restoration is high, or they cannot bite in a normal way they used to before, or they feel that they keep clacking that teeth together. It will reduce the risk of failure due to fracture, hypersensitivity, pain, early wear. You will be able to manage broken teeth very efficiently, not just restoratively, but occlusally as well, because many times, even if you do nice restoration, but if you haven't managed occlusion, the restoration will still bound to fail. You will be able to restore multiple teeth without changing VDO. If patient doesn't need to have increase in vertical dimension of occlusion, you will still be able to do multiple restoration without changing VDO. In advanced, when you are doing advanced treatment, of course, knowledge of occlusion is very, very important if you're increasing or decreasing vertical dimension of occlusion. And in my opinion, again, if you're doing any of those treatment, you need to go back to basic and you need to go back to centric relation position and work your way forward from there. And of course, when you're doing multidisciplinary cases involving other disciplines of occlusion, such as orthodontic, implantology, you will be able to bring the whole mouth into harmony. And when you are asking orthodontist to do teeth straightening, you will be able to prescribe appropriate occlusal scheme, which will then help you in maintaining patients' teeth in a long term. So I hope you found this video useful. 3 tips you can take from this video is that make sure you assess patients' occlusion, non-working side, working side contact before planning any restorations to avoid any disappointment. Decide if you would like to raise OVD or video or not at the start of the treatment. So make sure that many times what I've seen is the colleague would do 1 or 2 restorations, patient has a lot of wear, and then patient now wants full mouth reconstruction. If patients then decide to have full mouth reconstruction and you haven't discussed about changing of vertical dimension, then those new restorations will need to be changed as part of full mouth reconstruction. So assess patient whether this patient needs change in vertical dimension of occlusion or not. And make sure you consider occlusal appliance such as Michigan splint if patient is breaking restorations, because it could be related to occlusion. So I hope you found this video useful. In the next video, we are going to discuss about conformative versus reorganized approach. If you have found this video useful, then please do not forget to share this with your colleagues and friends. And if you have any questions, please feel free to contact me on the social media or visit my website www.drdevangpatel.com.